The cycles approach is commonly used with children who are highly unintelligible. When looking at the cycles approach, there are 8 underlying concepts. 1. Children with normal hearing typically acquire the adult sound system primarily by listening. 2. Phonological acquisition is a gradual process. 3. Phonetic environment in words can facilitate or inhibit correct sound productions. 4. Children associate auditory and kinesthetic sensations that enable later self-monitoring. 5. Children generalize new speech production skills to other targets. 6. An optimal match facilitates learning. 7. Children learn best when they are actively involved or engaged in phonological remediation. 8. Enhancing a child's metaphonological skills facilitates the child's speech improvement and also development of early literacy skills. Prior to the start of therapy, the HAP-3 is a formal assessment administered to determine target patterns for improvement. Phonological processes are considered a target when it is used 40% of the time or more. In order for this approach to be effective, the targets must be stimulable. The first patterns to be targeted are primary patterns. Primary patterns consist of early syllable structure patterns, anterior-posterior contrast, and S clusters. Liquids are targeted at the end of each cycle. Secondary patterns are then targeted. Secondary patterns consist of palatals, other consonant sequences, singleton stridents, prevocalic voicing contrast, vowel contrast, assimilations, and any remaining idiosyncratic deviations. Some advantages to the cycles approach are children who have a moderate to severe speech sound disorder have clinically and statistically significant improvements in their speech sound production after receiving 2 cycles or 18 hours of treatment. It is found to endure over time, meaning that sound accuracy is still improved and stable during the later cycles. It can result in improved consonant production and conversation context. Children with less severe phonological and language impairments improve in both phonology and language when the cycles approach is used. Earlier implementation of the approach results in more successful outcomes. And lastly, it has been shown that phonological acquisition is a gradual process, so this approach supports this principle by giving children limited but successful experiences with one of their targeted patterns, then not treating it for a while until it is presented again in a later cycle. Some disadvantages of the cycles approach are the error descriptions are based off typical phonological processes and doesn't account for outliers. It is not relevant for outlier errors. It targets new sounds or patterns every few sessions, regardless of a child's proficiency, and it can move too quickly for some children if new sounds are continuously introduced without ensuring stable use of the sound. For our therapy session, we decided to use the Just for Kids Phonological Processing book as a guide for our activities. This product goes beyond the traditional drill-like approach to phonological processing therapy by incorporating targeted processes into fun, natural activities. Each lesson is centered around an age-appropriate theme that offers opportunities for vocabulary development as well as many levels of practice with the targeted phonological processes and associated phonemes. First, before you begin the activities in the lesson, a pretest is given to measure the child's ability to produce the target process and which phoneme he or she is most stimulable to. The clinician can model for the child to repeat, or children at a higher level can read them on their own. The phonological process we are working on during this cycle is velar fronting with the phonemes K and G. Okay, Adrian, I'm going to have you repeat some words after me, okay? Call,
Tall,
camp,
tamp,
coal,
toll,
cone,
tone,
cub,
tub,
gab,
dab,
gap,
dap,
geese.
geese.
Okay, good job. Just a few more, okay? Ache,
Eight,
bag,
bad,
bug,
bud,
deck,
debt,
fake,
fate,
fig.
fit.
Good job. At the beginning of each lesson, a list of target words is provided. These words are theme-related and contain the chosen phonological process and associated phonemes for that lesson. When appropriate, the words are listed in groups of initial, medial, and final position. These same target words are used throughout the activities. So next, we read these target words aloud to the child to auditorily bombard the child with the words we will be using during the activities. All right, Adrian, it's time to listen to our words. And remember, we don't say anything, you just listen, okay? Cake, candles, candy, card, cook, get, gift, give, go, goodbye. Bakery, chocolate, bake, bike, egg. Next, the clinician and child will complete the activities within the lesson. These activities will address the phonological process being targeted. The clinician will record data throughout the session using the plus or minus method. The clinician will provide verbal feedback to the client using phrases such as good job and awesome. Note, in this segment, the clinician and client will only complete 2 activities, but within the Just for Kids phonological processing book, there are several more activities to be completed throughout numerous sessions. Adrian, are you ready to play some games? All right, I'm going to show you some picture cards, and I want you to tell me what's on the picture, okay? But make sure you use good K and G sounds, right? All right.
Tate,
Cake,
tids,
kids,
baked,
bake,
tup,
cup,
tootsie,
cookie,
game,
game,
diff,
gift,
tandles.
candles. Good job. All right, Adrian, now to our next game. Miss Kara's going to have you sequence a story. Miss Kara's going to tell you what's happening in each picture using our target words using K and G, okay? And then I'm going to ask you which one comes first, second, third, and last, okay? You ready? All right, let Miss Kara lay them out for you. Okay. Kip and his mom are baking a cake, okay? And they're having friends over for Kip's birthday party. And the kids are bringing gifts, and they're cutting the cake, and they're going to have candles on the cake, and then they're going to go, and they're going to say goodbye. Okay? All right, Adrian, so tell me which picture shows Kip and his mom baking a cake using eggs and milk? Good job. All right. All right, next, show me the kids coming over to Kip's house and giving him gifts. Good job. Okay, now show me Kip blowing out his candles and having juice in cups. Good job. All right, now show me the kids saying goodbye to Kip and going home. Good job. Awesome. Finally, after all the activities are completed, a post-test is given to measure the child's progress. Again, the clinician can model for the child to repeat, or children at a higher level can read them on their own. Okay, Adrian, I'm going to say these words and I want you to repeat after me using your good K and G sounds, okay? Call,
Tall,
camp,
camp,
coal,
toll,
cone,
cone,
cub,
tub,
gab,
dab,
gap,
dap,
geese,
geese,
ache,
ache,
bag,
bad,
bug,
bud,
deck,
deck,
fake,
fate,
fig. Now that you have just seen a glimpse of one cycle, we would like to explain that typically these activities from one lesson are implemented over 3 to 4 consecutive sessions before the post-test is administered. Once the post-test is given, the first cycle is considered done and it is time to move on to the next cycle. The next cycle would incorporate a different phonological process the child uses. Once the cycle is completed for that phonological process and any other phonological processes the child is using, the clinician and client rotate back to cycle 1, velar fronting.